Good afternoon, and thank you for joining the National Caucus and Center on Black Aging Incorporated, NCBA, and Amgen for our webinar today on The Air We Share, Asthma Empowerment in Older African Americans. Our host for this session is Katie Rokowitz of Amgen. Dr. Katie Rokowitz earned a Doctor of Pharmacy degree from the University of North Carolina at Chapel, Virginia Commonwealth University Health System for more than 15 years before transitioning to her current role as a medical science liaison. As both an advocate for and a recipient of biologic therapy, Katie recognizes the impact that scientific advances can have to improve the lives of patients. She is an advocate for improving access to these therapies and has a unique understanding of the barriers that exist. Katie resides in Richmond, Virginia with her husband, 2 children, and 2 dogs. Welcome, Katie. Also, our presenter for the session is Arinze Onwalu of Amgen. Arinze Onwalu graduated Temple University in May 2022 with a doctor in pharmacy. While in university, Arinze's academic focus was on clinical research, covering topics like clinical trial management and good clinical practice. His involvement in groups such as the Industry Pharmacists Organization provided him with a comprehensive understanding of the pharmaceutical industry's operations and ability to assist patients. After graduating, Arinze was accepted into the 2-year Howard University College of Pharmacy Pharmaceutical Fellowship Program, where he began work with Amgen in 2022. There, he took part in multiple projects, including the development of medical content, engagement in scientific inquiry to address unmet needs in the communities. He participated as a member of the Representation in Clinical Research, or RISE, R-I-S-E, and he communicated patient education services via the Learn to Understand and Manage Severe Asthma program, or LUMA. Thank you and welcome, Katie and Arinze, and the floor is yours. Thank you.
Thank you so much, Angela.
Thank you for joining our LUMA program today. As Angela mentioned, today's program is a LUMA-sponsored program. LUMA stands for Learning to Understand and Manage Severe Asthma. Today, we're going to talk about how to develop an action plan and how an asthma symptom journal can help your provider manage your asthma in the most optimal way. Before we get started, I have a few comments, mostly housekeeping concerns that I need to address. So this program is being presented on behalf of Amgen and AstraZeneca, the sponsors of this program, and is being presented in accordance with Amgen and AstraZeneca's compliance programs, as well as FDA regulations. This is an educational program and should not be construed as a representation that any specific therapy might be safe or effective for treating any particular disease. We invite your comments and questions, but again, your video and microphones have been turned off, so please utilize the question and answer chat window on your screen. For more information about LUMA or to schedule future programs, visit our website at luma-edu.com. Finally, no medication-specific questions will be addressed during this time, and if you have questions related to your own health, please address them with your healthcare provider. So the first question I'd really like to talk about with Arinze, and I'd like to pose to him, is why is asthma education important to us?
Well, Katie, according to the CDC and American Lung Association, asthma affects almost 25 million people in the US. Up to 2.5 million people in the US have severe asthma, and up to 50% of these people are uncontrolled. Having ongoing symptoms and flare-ups doesn't automatically indicate severe asthma. Asthma symptoms can vary, and not everyone experiences the severe forms of the condition. It's essential for individuals with asthma to work closely with their healthcare provider to manage their symptoms effectively and prevent exacerbations. And by doing so, they contribute to a healthier environment for everyone, since we all breathe the air we share. Next slide. Now, what are the factors that contribute to the asthma disparities we see? There's racial disparities in asthma, or racial disparities in asthma are the result of complex interactions between various levels of social, structural, biological, and behavioral determinants. This includes factors like economic stability that lead to disadvantages such as poverty, poor housing, and lack of access to healthcare. Factors like distress in the community due to historical exploitation of Black bodies in medical experiments such as the Tuskegee study, and factors like response to treatment due to genetic variations related to asthma in Black and Puerto Rican populations. Next. Now, the reality of the situation is that Black individuals experience worse asthma outcomes when compared to their white counterparts. When we look into the statistics, asthma is disproportionately diagnosed in Black Americans. They are 2 times as likely to be hospitalized due to asthma-related complications, are 5 times as likely to visit the emergency department due to asthma, and are 3 times as likely to die from asthma, with the highest death rate being in Black women. The causes of asthma remain unclear, and its symptoms can change over time. While some children may outgrow asthma or see symptoms disappear after long-term treatment, it often reoccurs later in life. Next.
So, Arinze, I don't know if I've ever told you, but I actually have asthma. And most of the time I feel pretty good. But how should I know and how do others know if our asthma is actually well controlled or if we should be seeking additional care?
Excellent question, Katie. We can use the rule of 2. Indicators of uncontrolled asthma include the use of your short-acting beta-2 agonist reliever more than 2 times a week for symptom relief. If you're awakened at night with asthma symptoms more than 2 times a month, refilling your reliever medication more than twice a year, and the use of oral corticosteroids more than 2 times per year. Now, if you answer yes to one or more of these questions, your asthma may not be well controlled, and you should plan a visit with your healthcare provider and talk about the state of your asthma.
And are there any tools that can help me manage my own asthma?
Yes, there are. So firstly, we can create an asthma action plan to control and prevent asthma attacks. Your unique asthma action plan should tell how to manage your asthma daily, what to do when symptoms get worse, how to adjust your medications, and what to do when you exercise or get sick, and who to contact in case of an emergency. You should work with your healthcare provider to develop a written asthma action plan that should be updated regularly and brought to appointments. Now, a typical asthma plan is divided into 3 zones: green, yellow, and red. The green zone is where you want to be on a daily basis. In this zone, you have no asthma symptoms and feel good. Continue taking your long-term control medications, follow exercise recommendations, and avoid known triggers to keep your asthma well managed. Now, the yellow zone, this means that you're experiencing some symptoms. In this zone, slow down and follow steps to prevent your asthma from worsening. Continue taking your green zone medications along with additional quick relief medications as specified. If you don't improve, get worse, or remain in the yellow zone for more than 24 hours, follow the red zone instructions and call your doctor. Now, the red zone means you are experiencing severe asthma symptoms or an asthma flare-up. In this zone, seek immediate medical treatment and take your quick relief medication as specified if symptoms worsen and your regular medication isn't helping. Call 911 if the following danger signs are present: trouble walking, talking due to shortness of breath, lips or fingernails are blue, and you're still in the red zone after 15 minutes. All the zones. Now, here are some excellent examples of asthma action plans and QR codes that can take you to specific resources mentioned.
No, Rinse, I see on most of these action plans. So what I would do is I would go and I would use the QR code to download the action plan. And it looks like I would fill out the top portions and then I take it with me. Is that like an acceptable, like, are physicians receptive to me walking in with a piece of paper for them to fill out like that?
Oh, absolutely, Katie. You can take any of these asthma action plans, help and take it to your next appointment, and you can go through it with your healthcare provider to create your own unique asthma action plan.
And then I see that most of these plans, they're divided by green, yellow, and red. And most of the time, those correlate to a peak flow. What's a peak flow?
Yeah. A peak flow meter is an over-the-counter device you can purchase inexpensively that you can use to measure how much air volume you can expel. To use, you can sit up straight, move the marker to the bottom of the numbered scale, put it in between your teeth. Hard to do without it in my hands. Between your teeth, blow out as hard and fast as you can in a single blow, and then you make sure that you write down the number that you get.
So it's like blowing out candles on a birthday cake.
Similarly.
And then if I do it a couple of times, do I take the worst number or the best number or the middle number?
Make sure to share all the values that you have with your healthcare provider. And he or she can use those numbers to create your own unique asthma action plan. Yeah, so now we have another tool we can use in the management of asthma, an asthma journal. An asthma journal helps you collect information about your asthma and develop an action plan with your healthcare provider. An asthma journal can be seamlessly integrated into your daily routine. You can record it on your smartphone, your laptop, or in a simple notebook, and use it during periods of worsening asthma control, to identify new triggers and to monitor your response after a treatment change. It is also valuable for reviewing with your doctor to develop or update your asthma action plan. Now, to the right, we have an example of the Luma Asthma Journal. We can use this to track your triggers, disruptions in daily activities by your asthma, symptoms experienced, medications used, and peak flow readings, as we mentioned before. Next slide.
So I understand that asthma is really important and it helps us breathe and we don't want to wheeze when we're walking or exercising or running. But why is it important for older adults to well manage their asthma?
That's an important question, Katie. So let me start off by saying that approximately 8% of older adults in the United States suffer from asthma. There may be changes that exist for older Americans dealing with asthma. Older adults may be underdiagnosed with asthma. Lung function tests can be challenging for this population, and it's important to consider other conditions that might mimic asthma symptoms or medications that could exacerbate them. Older adults may also be undertreated for asthma, and managing their asthma may be more difficult. Managing asthma can be complicated by factors like treatment-related fear, reduced cognitive and motor abilities, difficulties using inhalers due to arthritis or breathing limitations, and the need to manage other chronic health conditions, which may also impact eligibility for clinical trials. Now, older adults may have worse asthma control because of health and socioeconomic factors like cost of medication, limited income, and gaps in health insurance coverage. For this audience, it is important to remember that Black and Hispanic older adults visit the ER 1.5 times more than their white counterparts. And Black Americans have 149% chance or 149% higher asthma mortality rate than white Americans.
And the last question I have for you is, as I'm learning as I get older, more and more comorbid conditions and healthcare issues seem to pop up. What other diseases can impact asthma management?
Yeah, this is very important, especially in older populations. Asthma is often associated with various other diseases. These diseases may influence asthma control and response to treatment. So examples of some conditions that co-occur with asthma include allergic rhinitis, sinusitis, atopic dermatitis, food allergies, and anxiety. Patients suffering from these comorbid diseases should keep asthma management in the forefront of their minds. Now, remember, proper management of your asthma contributes to a healthier environment for everyone, since we all breathe the air we share. Thank you, everyone.
And at this time, I think we're going to start to answer some questions that you all have. One of the questions that I see in the chat is, does allergies lead to asthma? This particular person has noticed more coughing and slight discomfort lately with the increasing pollen and other allergens. And he or she is thinking about asking his or her PCP about an immunology referral.
Absolutely. Allergies are triggers for asthma, and you should definitely go talk about these allergies or certain allergens that you have with your healthcare provider to see what you can do about the state of your asthma.
I think it's also important to recognize, so maybe seeing an allergist is something that could be helpful, because the more information we have about which particular pollens or triggers actually influence that, the more we can at least be aware and anticipate that that's going to happen. What other questions do we have? Please put them in the chat.
Katie and Arenze, thank you very much, Arenze, for such a stellar presentation. And while we wait for questions to come in the chat, I have a question or two that I'd like to ask, if I may. First, I want to ask, Arenze, could you please define for me and the audience, when you speak to uncontrolled and controlled asthma, what does that mean, please?
Yeah, so uncontrolled asthma is the state of your asthma still having symptoms and flare-ups, even with the medications that you're on. Now, we define asthma by the medications that you are on, and so if the medications that you're using aren't enough to control your asthma, it might be time to either bump up your therapy or adjust your therapy as needed. So it's an important conversation to have with your healthcare provider if you're still experiencing flare-ups on the medications that you are using.
Okay,
Especially those exacerbations, Angie, that require either bursts of oral corticosteroids. Remember that oral corticosteroids have systemic consequences and side effects. And those exacerbations that are requiring that you either see additional medical care. So those that are requiring emergency room visits, urgent care visits, those are truly the type of exacerbations that we are most concerned about. Although we certainly want to have symptom-free days and, symptom-free ability to exercise and to rest at night.
Okay. So then in our journals that we're keeping about our asthma condition, should we also note any side effects that pop up and so that we can present those to our healthcare providers? Is that helpful to them?
It's very helpful. As much detail as you can about your asthma state, including the medications, the side effects, the triggers, how many exacerbations you have in a year. All of that is helpful for your medical provider to create a unique plan for you.
Okay. All right. And as we wait for those questions, look forward to hearing from our audience. I'm going to take the liberty and ask just a few more questions if I can. So most of us, myself included, are on the East Coast, and summer is here. And it is hot and humidity is here. And so my question is, can changes in the weather trigger asthma?
Angie, yes, absolutely. And it's important for asthmatics to pay attention to those weather changes, whether it's through an app. It's important to keep track of the triggers that are in the air and the humidity around you. More humidity in the air leads to more mold in the air. And those molds can also provide or be a trigger for your asthmatic symptoms, making your asthma worse. So it is important for you to watch the weather and keep track of what kind of weather triggers your symptoms.
Okay. And then before I jump to the chat, I just want to ask one other question. I'm just curious. If I am an asthmatic, should I carry my nebulizer if I take or other medicines with me? And if I carry them on my person, is there a proper way to carry them? Like, can I just throw them in my backpack and be done with it? Or should I put them in some type of baggie or how should I transport them?
Well, it is important to transport your medications together. Make sure that you have them all grouped up. And it is important for you to keep your short-term relief medication at all times, just in case you get one of those exacerbations that Katie talks about, to prevent a situation of you going to the hospital for those exacerbations and for you to breathe as you get through your specific task or journey.
Okay, thank you for that. So I'm going to jump to the chat here, and we have a few excellent questions. Someone asked, "Do providers discuss diet with when it comes to asthma, like foods and foods that cause inflammation? Is that a common discussion with healthcare providers?"
I'll take
I'm
that
not
question,
okay. Go
Arinze.
ahead.
So, yeah, there's a couple of different ways that food and diet can contribute to asthma. The first of which is that patients that are obese will have more symptoms and asthma-like symptoms than those who are non-obese. So providers are pretty well versed on that, and they're pretty good about educating on dietary modifications in order to become a more ideal weight. That's one way. The second way that providers are aware, and I think very well versed on the relationship between food and asthma attacks, is any known food sensitivity needs to be very carefully mitigated. So, patients that have food allergy should be referred to a specialist. That's a guideline based recommendation. So, for instance, if you have a known allergy to peanuts, you should be seeing an allergist to manage your peanut allergy because that can lead to, or exposure can lead to an asthma attack. And the last thing I think is probably the lesser or like not as common in terms of um, PCP involvement, and it would really involve how well versed your PCP is on kind of more homeopathic mechanisms of foods contributing to inflammation. We do know that there are some relationships between like foods that are high in saturated fat and overall inflammatory states. The other thing that can trigger wheezing in asthmatics is exposure to sulfites. So remember that sulfites are preservatives. They're found in things like wine, dried fruit, some pickled foods. Um, and sometimes exposure to sulfites can trigger asthma attacks. So I would say some of, these kind of increasing overall inflammation is probably the one area that your PCP is not going to just bring up on a whim, but may be able to discuss with you if you can talk about it specifically. A registered dietitian might be also a good resource for those type of interventions in trying to, increase antioxidants and then decrease overall inflammatory triggers.
Okay. Thank you. And I'm going to build on that just a little bit, Katie. We spoke to food, and I want to turn the corner here and maybe speak to exercise. And more of us are out walking now and playing pickleball, or at least I'm trying. Not very good at it, but I'm trying. And if I were an asthmatic, and how would I regulate my exercise? On the East Coast where I live, it is humid. How might I safely exercise outdoors or indoors?
You want me to take it, Arinze?
Oh, I thought she was asking you. I could take it if you
No,
want.
either way, I'll take it. So,
Uh,
the the easiest thing you can do is to know which pollens seem to trigger asthma. And it may be the case that if you are at a really high pollen season or a high air pollution season, that you choose to exercise indoors, right? Whether it's walking around a mall, a fitness center, anywhere, your YMCA, places that you can go where the air is exposed to an air conditioner, which both pulls out the humidity and also filters the air. Now, some things that can help if just humidity in general is a trigger is exercise in the morning, right? Or later in the evening when it's not the peak of the heat. Um, being aware of our triggers. The other thing is looking online and making sure that you're looking at the indexes for both heat, pollen, and air pollution.
Okay. Okay, thank you with that. And something Arenze said struck a chord with me about making posting our asthma condition. So is it important for those of us who may have asthma? Should we wear some type of identifying medical bracelet to, in case we have an attack, and we would have something to let the public or people who don't know about our asthma know that we are asthmatic, and this is and we might need assistance. How would we go about saving our own lives?
yeah, no, it's great to be an advocate of your own health. I don't believe that every asthmatic needs all of that, but I think that's something that's important to discuss while you're talking about your asthma action plan with your healthcare provider. If your medical provider deems it necessary or deems it as an important thing for how severe your specific asthma is, then I would take the advice of your medical provider.
Okay, all right. And looking at the chat, we've got another question and I welcome our audience to keep those questions coming. The next question asks, can you speak to the danger of marijuana smoke, especially for asthma and allergy sufferers? Part two to that is, what are some of the resources given marijuana is legal in many states?
You want to take that or me, Katie?
I can take it.
Mhm.
So now marijuana smoke is one of the emerging topics in healthcare, and I think we're learning more about it every day. There are some things that are very important to remember that marijuana smoke is smoke. It doesn't necessarily have the same chemicals in it that tobacco smoke carries, but there are still um, trigger causing components within marijuana smoke. So until we learn more about marijuana and about marijuana smoke in particular, I would say that if you're a severe asthmatic, you should avoid any smoke that you can and recognize that no smoke is completely safe.
I would
Okay.
also add on, oh, sorry. I would just also add on that if you are in a situation that requires you to take medical marijuana or a situation like that, there are other options available, such as different foods that are contain medical marijuana, tinctures, things of that nature. And that's probably a better alternative than smoke, like Katie mentioned.
And then, if I can just ask, for those of us who are apartment dwellers and we share our living spaces with others who might smoke, regardless, be it medical marijuana, or just nicotine, how do we go about safeguarding our lung health? And if we do live with asthma, but we live in a community, what can we do to safeguard our homes and our breathing environment?
I could take that. Yeah, no, I mean, I think first and foremost is to limit as much secondhand smoke as you get. Whether that means individuals smoke outside, or if it's smoky outside, to stay inside. I think another good option is to have an air filter. As a mild asthmatic myself, I find that air filters help a lot. They use a HEPA filter to pull pollen and smoke and dust and things of that nature into this filter and breathe and expel clean air. So we can keep the air that we share clean. And another thing is to have a dehumidifier if the humidity in your home is not adequate for your asthma state. We can dry the air out and have better outcomes for your asthma state.
Okay. So, Renze, I'm going to ask you to define, please, a dehumidifier and all those other wonderful tools that you spoke to. I know when I'm vacuuming, I'm conscious of the HEPA filter and so forth, but everyone doesn't have a HEPA filter vacuum cleaner. And I still appreciate a good old fashioned oscillating fan. So can I ask you both maybe to speak to some of those tools that we can use or invest in to keep our asthma, to manage our asthma?
Yeah, and there's nothing wrong with an oscillating fan as long as we keep it clean. If we need to cool the space that we're in right now, it's important to keep those kind of tools. Whatever I talk about, the HEPA filter, dehumidifier. It's important to keep those tools clean, clear of dust. HEPA filters are filters, tiny that they have tiny filters that block out that intake air and block the pollen and block the dust and block the smoke and keep it within the filter, expelling cleaner air. Now, dehumidifiers, I don't know if you want to talk, jump in, Katie, but dehumidifiers have the ability to just to take in the air and absorb the moisture in the air in the filter that's contained in the dehumidifier and expel drier air. So those tools are very helpful, especially for severe asthmatics.
Yeah,
Okay.
just to elaborate on that a little bit more. So, HEPA it's an acronym, right? So HEPA stands for high efficiency particulate air. And what that means is that just like we have normal filters that go in our like HVAC ducts, they have smaller holes than what a normal filter would have. So it filters out more of the pollutants that are in our air. You can get really fancy, really expensive HEPA filters like that are standalone units, and they basically just clean the air that you're sitting in. Or you can go to Lowe's or Home Depot and buy a HEPA filter that goes in your normal vent instead of a traditional air filter. They're just a little bit thicker, and they filter more of that particulate matter out of the air.
Okay.
And then in terms of a dehumidifier, right? So dehumidifiers pull the humidity out of the air. So they're good at taking the moisture that's in the air and converting that, like condensing it down to water and leaving the air that's remaining to be more dry. And drier air is better for lung health.
Okay. Thank you. Thank you both for that. We've got a terrific question here in the chat, and it asks, how can African Americans how can African Americans participate in asthma clinical trials?
Yeah, so I would say that it's important to talk to your healthcare provider about ongoing trials within your area. I know that here at Amgen, we have a great program, RISE, trying to include more African American and other people of color into these clinical trials so we have better outcomes, or we can see better outcomes for these patients. So if there's a RISE program or other programs within your area, it is important to talk to your medical provider, and he or she would have more information about the ongoing studies in your area.
Okay, thank you. And we are going to wrap our conversation up with just one question for the both of you, if you don't mind. Now that we know it's important to manage our asthma, what is our plan of action? What should we be doing? What should everybody do when we get off of this webinar? If you're living with asthma or have a loved one or someone you know living with asthma, what should our next plan of action be?
Well, you or
Go
me,
ahead.
Katie?
You
Okay.
go.
Yeah, I mean, once we leave this webinar today, I would suggest going through the tools that we talked about today, going through those rule of twos. Does that pertain to you? Then making an asthma action plan or thinking about making an asthma action plan that you can take to your provider. An extra step that you could take is using that Luma journal that we provided to kind of start writing down your daily triggers and things that we've mentioned within the PowerPoint. And you should be good to go on your next medical visit.
Okay, I like that. Katie, would you like to weigh in?
I just am going to echo what Arinze said. I just think it's really important for you to understand what good looks like. You know, asthma control is really important, and you should be able to um, exercise without wheezing. You should be able to walk to the mailbox and back without being short of breath. You should be able to sleep through the night without waking in the middle of the night. You should be able to go a year without needing a burst of oral steroids. So, understanding what asthma control is and how that looks, and then understanding that if you're not well controlled, that your healthcare provider can truly help you come up with a plan to achieve control.
Well, I like that. And that's a perfect segue to say thank you both. And to our audience, if we don't have any other questions, um, we'll give it a few minutes here. I want to thank both Arenze and Katie for joining us, for always being willing to join us and to share on the importance of managing our asthma. So again, I don't. It looks like we don't have any questions, and we're going to give everybody back their day a little earlier this time. But we look forward to seeing you all sooner than later. Again, thank you very much. We appreciate having you,
Thank you
and
for
thank
having
you to
us.
our audience. Thank you very much to everyone for joining us. Very helpful. Have a good afternoon.
You
Bye
too.
bye.
Thank you.